My name is Cassandra Wolf. I am 33 years old, and we are currently at the Phoenix Salon Suites in Cyprus, where I own my business. I am esthetician slash owner of Lasting Impressions by Cassandra. So my main injury, I was 13 years old, and I was playing softball for Seal Beach, and I was sliding in to second base, and I rolled funny and tumbled right into the corner of second, and it went right into the small of my back. And that's when everything started. I was going to the emergency room once a month from the time I was 24, I believe, up until 28, and every month it's a pulled muscle. It's a pulled muscle. She told me that I had arthritis and spinal stenosis, and that was it. And she said that if I was going to continue to be on pain medication, I had to see pain management. So when I got to pain management, he said, there's nothing I can do for you. I can give you pain meds, but you need to see a surgeon. You have an 18-millimeter herniated disc. You need to go have surgery. I can't help you. It was about 15 years before we realized that it was a herniated disc. So as soon as I got home from pain management, I called my primary care office, and we got the appointment on Wednesday. They rushed a authorization through, and I was in surgery the following Wednesday to have a discectomy and a bilateral foraminectomy. I still didn't have a lot of feeling in my feet, going from about knee down, and it didn't help. It just kept getting worse. And then about a year and a half after surgery, I was at the vet with my 4-pound chihuahua, and I stood up and it reherniated again, and I felt it. The second surgery actually went well for what I thought it went well. The pain was minimal. I was back to work in 3 weeks, and everything was pretty good for about a year before it reherniated again. The third time it reherniated, I believe they said it was 14 millimeters. My pain management doctor, because I was seeing a whole new set of doctors at this point, did the MRI, and then she asked me if I wanted to go to my original surgeon's office, even though he wasn't there anymore. I'd see his partner, and I didn't want to see his partner. So she sent me to Dr. Harry, and it was just, it's been amazing ever since then. He knew exactly what to do. Was pretty confident. He told me the risks that were involved, but I had a feeling that he would do a good job.
I met Cassandra in February of this year as a second surgeon for her back pain. It's interesting because Cassandra has had 2 prior surgeries. She had surgeries at the L4-5 level twice before, both times for a herniated disc that was causing leg pain. She never really had a good recovery. She was never fully back to normal. And when she came to see me, she was having persistent back and leg pain. As a matter of fact, her leg pain had gotten worse. Just based on the back pain and the leg pain and her MRI findings and her x-rays, she clearly needed surgery. So what I talked to Cassandra about is that she needed to have a decompression at that L4-5 level. Her MRI showed that the disc that had been decompressed previously twice had reherniated. There was a large fragment of disc that was pushing into her canal, and the central canal, which is here, had no room for any of the nerves. There was no fluid around the nerves. The disc was pushing against them, which is why she was having leg pain. More importantly, she had significant abnormality in the bony anatomy of her back. Between L4 and L5, there was no connection. The pars and the facet joints, these are this parts of the back, were missing. So although the decision to proceed with surgery was simple, the decision that she needed a fusion was simple, that she needed a decompression was simple, there were some complexities. The complexities lie in how to approach it. You can do open surgery, you can do minimally invasive, you can go from the front, you can go, and then go from the back, or you can go all from the back. And we kind of debated back and forth about which one would be the best option. And because she had so much scarring and no bone, minimally invasive wasn't going to work for her. So she needed a big open operation. And that was what I recommended to her, and she agreed. We exposed the back of the canal, and then we spent a great deal of time taking down the scar tissue, releasing the nerves, going anteriorly to take out the disc. Once we had everything decompressed, we then proceeded with the fusion. So the decompression takes care of the nerve pain, but we had to get rid of the back pain. The fusion takes care of her back pain.
He spent a lot of time with me, going over my MRI results. He made it look as if my back was moving so that I could see exactly where the problem was. He went above and beyond what he was supposed to do. He originally wasn't going to be able to do any decompression. We were just getting in, doing the fusion, and getting out. He did so much more than he was planning on doing. And it was immediate when I woke up. I could feel a difference. I could feel my feet. I feel amazing. I'm not 100% yet, but I'm probably like 98%. Everything that I couldn't do for the last 20 years, I can do again. I know it doesn't seem like that there's a lot of hope on those days when we can't even get out of bed, but there is, trust me. I am living proof that it gets better, especially if you have a competent surgeon. Just stick with it. Don't give up.